going to discuss the in-office workflow for your SmileSnap consultations. Now, your workflow, or lack thereof, can make or break you, but it's also not set in stone. So if your workflow isn't working, you can fix it, and the solution is probably easier than you think. I'm going to cover my ideal workflow based on my experience overseeing virtual consultations in a large, very busy practice. You can tailor it as you see fit, but there are some non-negotiables I'll discuss as we go along. What made the most sense for us, given our size and the patient flow, was the simplest workflow possible. Receive a patient's consult request, message the patient, work up a treatment plan and estimate, record the consultation, and direct the patient. Let's talk about each of these items in brief. Number 1, the patient submits a consult request. If you have your marketing set up correctly, this one takes care of itself. If not, that's a topic for another video. Number 2, what's the first thing you do after a patient submits a virtual consultation? Message them immediately. This is one of those non-negotiables. Stop whatever you're doing and shoot a quick reply, something along the lines of, "Hi Sarah, this is Dr. Brown. Thank you so much for sending in your consult request. I really appreciate you trusting me with it. I'm going to look over your photos and record a video for you by the end of the day. Talk soon." Short and sweet, but it lets Sarah know that someone is actively responding to consult requests, and it gives her an anticipated timeline. Most of your patients are going to have some familiarity with online forms, but there's a varying degree of responsiveness. Sarah may have put this consult in on a lark with no real expectations, but your quick 5-second message lets her know that this is not one of those online forms, and you will be getting her something over ASAP. Additionally, if Sarah didn't include pictures, this is the perfect time to ask for them via the photo request. Let Sarah know, "Hey, I can complete this consultation without photos, but it won't be as detailed or as personalized." Reassure her that you'll be the only one looking at them. That's a big concern for patients. I know sending photos to a stranger can be scary, but I promise you that I'm the only one who has access to them. They'll help me give you a more comprehensive treatment recommendation and a more accurate cost. If you can, please snap a couple photos and add them to your consult. Now the ball is in Sarah's court. If she doesn't send pictures, that's okay. You can do the consult as is. But if you get a response with additional information and photos, even better. Number 3, now that you've given Sarah a timeline, it's important that you stick to it. Work up a detailed treatment plan and estimate based on the information you have. It doesn't have to be perfect. You're gonna let Sarah know that all of this is an estimate and may change. I made a treatment plan specifically for patients who didn't submit photos. In my mind, those patients were kind of a blank slate. We may not have been able to provide an accurate diagnosis, but we could still let them know everything there was to know about our office. I included hours, the types of dentistry we specialized in, conveniences like same-day appointments, Saturday appointments, CERAC crowns, and sedation dentistry. Think of it this way. Sarah sought you out and put in a consultation on her own. That means she's actively interested in what you have to offer. So show off. Your website probably has a page titled, "Why Choose Us?" This is your opportunity to tell Sarah exactly why she should choose you, even if you don't know the specific treatment she needs. And let's be real, whatever that treatment is, Sarah probably doesn't know that much about it, and there are 50 other dentists in your area providing it. Make yourself stand out by highlighting your top features using the treatment plan. If you have testimonial videos or procedures or doctor biographies, link them in the treatment plan text. Pack it with as much information as you can, knowing that Sarah can look it over and show it to her friends and family at her leisure. Number 4, record the video consult. Now the specifics will largely depend on the quality of the consult request, but there are some bullet points you should hit regardless. First, introduce yourself. Include your qualifications, your experience, and something personal about you. Remember, you're not really selling the treatment. There are dozens of doctors in the area offering the same thing. You're selling yourself and your office. Second, address what Sarah would like to change about her smile as much as you can based on what you have from her. Again, this doesn't have to be perfect as it will likely change, but you want to make sure you're solving Sarah's main concern, no matter what treatment you end up recommending. Third, cover possible treatment options, the months of treatment, and the number of office visits. Here you're going to think about rough estimates, just enough to educate Sarah about the different routes available to her and let her know if this will take 2 months or 2 years. Finally, you should close with financing. Include the fee range, the number of patients, monthly payment range, etc. Offering a promotion or special? Talk about it here. Do you have a cash discount? Mention it. Reassure Sarah that you're willing to work with her, regardless of her insurance status. If you have third-party financing, mention it and talk about the benefits. No down payment, low monthly payments, no credit check, pay over time. Whatever the benefits may be, highlight them for Sarah so she doesn't have to go digging for that information. And FYI, SmileSnap now has a financing button that appears in your finalized consult. So take advantage of it and provide a link for patients to get pre-qualified. Why? You're trying to address as many obstacles as you can within the consultation, and financing is often the biggest. Number 5, tell Sarah what to do next. This is another non-negotiable. If your patient isn't sure how to proceed, guess what they'll do? Some of them may message you, but a lot of them will just sit and wait. So be very clear here. Should Sarah call the office, book online, message you within the app? If you want her to call the office, tell her to let the person answering the phone know that she already put in a virtual consultation and she received instructions to call. You want whoever is responsible for booking to make sure her status as a VC patient is notated some way in your system. If you have online booking, use the SmileSnap scheduling link and tell Sarah that's your preferred way to book virtual consultations. Depending on your scheduling platform, you may even be able to create a specific appointment type just for virtual consultations. Give that appointment type its own fancy color. This will make them really easy to pinpoint on your schedule. If you want to handle putting Sarah on the schedule yourself, go through the process of having her choose a date and time through the messaging feature. Again, the goal here is to ensure that Sarah knows what to do post-video so she doesn't end up doing nothing. One final note. The most common question I get from doctors is a very practical one. How long should this video be? From what I've seen personally, best practice is 5 minutes or less. Now there's a sweet spot here. Under 2 minutes is pushing it. Over 5, also pushing it. Which way should you lean? That will depend largely on the quality of the consult request. If you have a lot of information from the patient and you can really dive deep, feel free to go a little over 5 minutes. But if this is one of those consults without pictures or an emergency patient who has a pressing need, you can keep it short and sweet. I've seen 90-second consults lead to a booked appointment in the case of dental pain for obvious reasons. In those cases, lean on the treatment plan text and use the video as a way to offer a quick introduction, a plea for them to come in ASAP, and booking instructions. There it is, a simple in-office workflow. Receive the patient's consult request, message the patient, work up a treatment plan and estimate, record the consultation, and direct the patient so they know what to do next. That's all I have for you today. Thanks so much for listening.